New research shows substance abuse among adolescents in this country is declining, but experts are concerned about an increase that they're seeing in vaping and cannabis use. Reporter Christian Benavidez has the details.
Adolescents face a barrage of difficult choices when confronted with alcohol, cigarettes, cannabis, and e-cigarettes. A new study from Columbia University Mailman School of Public Health looks at those choices. For nearly 3 decades, researchers tracked more than 500,000 young people in the U.S.
We have seen smoking go down, we have seen alcohol use go down, which is wonderful news. But we've also seen cannabis use go up, and we've seen vaping go up really quickly.
Study author Noah Kresge says substance use was higher in highly social teens and those who gathered in groups with less supervision. How today's young people view alcohol, smoking, and cannabis may also be a factor.
The increases in vaping are some of the largest, if not the largest, they have tracked in this study in its history. The trends are just so universal that there's absolutely a need to talk to your young people about vaping and cannabis especially.
It's estimated about 2 million middle and high school students currently use e-cigarettes.
Every day, thousands of kids start vaping.
A new campaign from the American Lung Association is raising awareness about the risks.
If we want to make vaping unattractive, uncool to the youth right now, it's kind of like we have to play fire with fire, right? They're not going to find them unattractive because of a doctor telling them. The way they're going to find them unattractive is by their own peers messaging.
Visit talkaboutvaping.org.
And the campaign encourages parents to have the vape talk to help kids steer clear of the harmful habit. Christian Benavidez, CBS News.
Research also shows that adolescents who use e-cigs are 4 times more likely to try traditional cigarettes. The amount of sleep people receive and when they receive that sleep could play a significant role in their risk of developing dementia. Researchers from China involved nearly 2,000 adults in the study. At the beginning of the study, none of the participants had dementia. Scientists followed up with them after more than 3 years and found that 97 of those individuals were diagnosed with the disease. The risk of dementia was 69% higher among those who slept more than 8 hours per night and 2 times higher for those who went to bed before 10 p.m. The Food and Drug Administration is admitting that it may have mishandled the baby formula crisis earlier this year. The agency released an internal review report acknowledging a number of shortcomings in dealing with the formula shortage, finding delays and lack of procedures and limits on FDA's authority. The report said going forward, the agency needs more staff, training, and equipment to handle such emergencies. Stick around. Hutch Johnson returns. He's going to have an update for you on your Wednesday evening weather planner.